So Professor Khosrow Adeli is now the president of IFCC. He has owned his Master of Sciences and Ph.D. in Ottawa, and he has also traveled to his postdoc activities, and now he's currently active in clinical chemistry research and is the principal investigator of the caliper, which he will talk a lot about. Now we can hear his presentation, which will be presented as a recorded presentation.
Bye. Bye.
Bye, Prof.
I really love, of course, Indonesian people, but also Indonesian food. I have to say that I really enjoyed my visit to both Bali and to Jakarta. But I have to say I enjoyed Jakarta even more, even though Bali is very famous for its, as a vacation spot. I enjoyed particularly the food in Jakarta, and I really enjoyed meeting people, colleagues in the Indonesian society, and we had a great time. I don't know, the people are very nice, the food is very nice, so what else can one ask? Unfortunately, my visit was very short. It was only 2 days, so I'm hoping to come back and spend more time over the coming year or two, hopefully. Sure. Well, hello, everyone. This is Dr. Adeli from Toronto, Canada. I'm pleased to be here to present on the topic of digital laboratory medicine. I want to thank the organizers of the Indonesia Association of Clinical Chemistry for their kind invitation. We'll be spending the next 30-40 minutes on this important topic. Medical diagnostic data management is increasingly becoming digital, and particularly with the recent advances in artificial intelligence and machine learning and data mining or big data mining, there's been really a revolution in the area of digital lab medicine and digital healthcare in general. So I'll be touching on some of this important topic. I represent the IFCC, or the International Federation in Clinical Chemistry and Laboratory Medicine. And this is a map of the IFCC basically community, which includes now 95 countries. We have national societies in every one of the 95 countries, and the Indonesian Association is one of the key societies in our Asia Pacific region. But we have representation around the world, and we also have affiliate association societies, as well as about 50 corporate members. These are diagnostic companies that are involved in the field of laboratory medicine and pathology. Now, in total, IFCC represents over 45,000 laboratory specialists and professionals, and we're proud to be able to represent this community. And what I'm going to talk about, which is digital laboratory medicine, is an important focus for the IFCC and its strategic aims. We have started planning many educational programs in this area, and would be happy to work also with the Indonesian Association to provide webinars, to provide additional assistance in providing education in this area, in areas such as artificial intelligence and related topics. Now, laboratory medicine clearly plays a central role in healthcare delivery. The lab, as I have shown here, plays a central role in identifying risk factors and symptoms, diagnosing disease, determining appropriate treatment for disease, and even helping in evaluating response to treatment. Therefore, lab medicine is part of the multidisciplinary team at the center of healthcare. To provide this important role, one needs to assure quality, and the quality of the lab is critically dependent on, of course, accurate and precise assays, so lab quality, intra-lab quality, validated methods and systems, but also accurate interpretation of lab results and accurate communication and rapid communication of laboratory results. And that includes providing interpretation, providing appropriate reference intervals and decision limits. So laboratory medicine is indeed a partner in healthcare, working with clinicians in the area of diagnosis and monitoring of patients with many different medical concerns. Now, over the past several years, there has been a drive to change the role of labs from simply being in a specimen-centered clinical setting or clinical testing centers, as just focusing on lab performance, lab quality, providing results without much thought or without much interpretation or without much communication with the clinical programs, to a much more basically involved role, where the lab is patient-centered, and it provides patient-centered clinical decision-making in the sense that it supports that, works with clinicians to support that kind of patient-centered decision-making, and is vested in patient outcomes, and is indeed a partner in care. And so, again, the key term here is partnership between the lab and the clinical programs. And to assist with this revolution, really, is the new era in medical lab data management and effective communication, effectively communicating laboratory data, potentially bidirectional interfacing with other key databases, including patient charts and other databases. And what is really making this possible is the innovations in e-communication tools. So the next slide, I want to highlight the importance of communication. The fact that communication is everything. And of course, we're all starting from very early on. Children are now very much familiar with electronic communication in their personal life, in their school life. And this is affecting every facet of our lives, including the lab. So communication is really key. And there has been a guideline developed by CLSI for actually electronic exchange of data. And this is called the Auto 0382. It's a guideline that's actually up for renewal or updating. It needs to be updated. It was actually developed a few years ago. But clearly, it's a very important component of lab service now is to communicate lab test results clearly and quickly to clinical decision makers, but not just numbers, but also providing assistance in terms of test selection, in terms of test utilization, and in terms of test result interpretation. So as clinical lab becomes more highly automated, the process of ensuring communication increases in complexities and poses more of a challenge. Therefore, labs need to be prepared to meet this challenge. Actually, the field of laboratory medicine is particularly a domain which offers a unique opportunity to analyze extremely large, rich, and complex data sets of information concerning medical lab test results. We in the lab are sitting on millions, if not billions of data points. In a country like Indonesia, because of the high patient volumes and the high number of tests performed, each hospital is sitting on hundreds of millions of data points on their local population. So there is a lot of big data available that can be mined to provide rich information in terms of patient diagnosis and monitoring. And this, most labs, not just in Indonesia, around the world, are not taking advantage of this opportunity. So more and more attention needs to be paid to the fact that we have access to a lot of good patient data and population data that can be mined. And these are largely lab data. And lab data are actually the most important objective data in patient charts. Most of the information in patient charts is subjective, but lab data is an objective piece of data, and we have millions, if not billions, of data points that can be used. If you look at, for example, lab data for the past 5-10 years, there's a huge amount of information that can be mined. So in recent years, an increasing number of web-based and mobile applications have been developed to try to improve access to lab test results, but not just the test results themselves, but potentially using artificial intelligence and other new technologies to mine that data further and provide more information to the clinician and to the patient. So you see simple apps developed and increasingly complex apps that aid in complex diagnostic data management and are powered by artificial intelligence. Now, here I have a number of examples listed of, and I don't have time to go over all of these, but I will show you some examples of these medical diagnostic data management tools. But there are many, many more. And if you go online, and you may be already familiar with quite a few others, but if you go online, you'll find that there is increasing number of these medical diagnostic data management tools and electronic apps or e-apps that are being developed. So one example is this program called eLab. It's a comprehensive medical diagnostic center and lab management software that provides a user-friendly interface and access continuum. It's actually linked to this other database. It's called imedDX.com to allow flexible patient search and selection. It also includes a dashboard, a lab dashboard that can be accessed by mobile and tablet, allowing patients and labs and hospital access to their reports. So both patients have access and the lab professionals and the clinicians have access. So this type of program is an example of a program where it can be quite effective in enhancing communication of patient lab results. Another example is this Davis's Lab and Diagnostic Test database. It actually contains hundreds of diagnostic test descriptions to help understand and implement critical test procedures. Each entry delivers details on test function, accurately interpreting normal and abnormal results, and preparing your patient. It also includes recommendations on pre-test requirements, intra-test procedures, and post-test care. And it's really geared towards those responsible for obtaining lab tests, which is really the labs and ultimately the clinicians who request those tests. The Davis's Lab database has actually been growing and growing. This has been around for many years, but it has been improved significantly in recent years, and is available to access. Another example is this lab mobile app called OPCO. Which allows clinicians to securely review pathology and lab reports anywhere and anytime. So even while they are traveling, they could be managing their patients. It checks for new reports and makes them available on Android phones and tablets for viewing, and displays a list of pending lab tests. So again, an example of where one could control tests that are ordered, results that are obtained, as well as additional tests, follow-up tests that might be needed. Another example is Lab Gear. This is a comprehensive pocket tool for over 200 medical lab tests with differential diagnosis and related symptoms. It's integrated with MedCalc, which is a calculation tool for normal lab value reference information. So another actually fairly popular tool, app that is being used now, particularly in North America. In the area of molecular pathology, there is a lab mobile. There's actually several, but this is one example designed to improve patient care by increasing the ease and the speed of clinical molecular tests. It saves times and is convenient for especially tailored for oncologists and pathologists. And the test can be requested from any location. So again, the clinicians can use this tool to request, test, and then also obtain results, interpret, and therefore manage their patients. An interesting tool in the area of hepatitis monitoring is this HEPA Expert. It's actually a very comprehensive tool that can help in the interpretation of lab results for hepatitis A, hepatitis B, and hepatitis C, and selection of serology tests, but also interpretation of the results. There are actually a total of over 61,000 hepatitis test result combinations that are available or are possible. And most of them are hepatitis B, which is actually pretty useful, I know, in the Asia Pacific region, which where this condition is fairly common. It automatically generates interpretive reports, including a detailed analysis with regard to viral exposure, immunity, stage of illness, prognosis, and infectiousness. So this is one example of a tool that can be is specifically focused on a disease category, hepatitis, and can be very helpful to both the labs and to the clinicians. There is a series of apps called databases called MD series. And the MD series, there are several of them. One of them is in the area of anemia. And I'm going to show you two, one in the area of anemia diagnosis and another in the area of AKI, acute kidney injury. The MD series for anemia allows the user to approach anemia, one of the most common hospital diagnoses, through the point of view of a hematologist. It actually effectively starts the workup of the patient, the anemia workup, before a hematology consult is necessary. It uses an algorithm to delineate over 35 causes of anemia, and there are many other features, and I've listed some of those here. So it is a pretty powerful tool that can actually look at, basically do a differential diagnosis based on over 35 causes, differential causes that could lead to anemia, and based on the laboratory workup to provide a potential diagnosis that can be helpful again to the clinician. Of course, after this tool is used, the hematologist consult then can help make a final diagnosis. So this is not necessarily replacing the hematologist or the hematology consult, but it is aiding and facilitating the whole process, and therefore improving care. Another area, there is a series, as I mentioned, including several different diseases. Another is called MD series AKI, acute kidney injury. And as you know, this is also a very common occurrence in hospitals around the world, including in Indonesia. This tool allows the user to approach AKI, one of the most common hospital diagnoses, through the point of view of a nephrologist. It, again, starts the AKI workup before a nephrology consult is necessary. It uses an algorithm to delineate over 40 causes of AKI. And it again has several features. It can actually do other calculations, for example, provide fractional excretion of sodium value through a calculator that's built within the software. It can therefore provide, again, information can then help the nephrologist when they do get involved and provide consult. They can be aided by the information provided by this tool. Another example, I'm going to show you a couple more examples, then I'm going to talk about another related topic. Airstrip1 is another example. It's actually a wider database, not just a lab tool. It actually includes, other aspects of patient care, and it shatters barriers, it's been suggested, between disparate data sources. So data coming from multiple vendors, bringing all live relevant data to the clinician's mobile device to provide a complete picture of patient health. So basically, it's able to collect data from multiple sources, including the lab data, to be able to provide a full picture. It customizes the user experience to each clinician's specialty, usage, patterns, workflows, and visual preferences. It also safeguards privacy. Now, I have to say privacy is a major concern when you use these electronic apps or databases and you include patient data. You have to, of course, ensure privacy of that information. This is a major topic of controversy currently as to whether patient privacy is being respected. So tools that are not appropriately protected and do not have a firewall, for example, and are not safe to use or in terms of privacy, then are not recommended. So one needs to ensure those tools are selected that have appropriate safeguards to protect privacy of patients. So this is an example where it safeguards privacy with secure transfer and presentation of patient data, removing uncertainty around security and regulatory compliance. It's actually been cleared by the FDA as a diagnostic tool. So those were mostly simpler apps and databases that were developed over the last decade, but increasingly tools are becoming powered by artificial intelligence. And I'm sure all of you have heard of this important topic. Artificial intelligence is clearly here. It's already being used in many areas of our lives, including lab medicine, and I'll show you an example. And AI is actually even talked about more in terms of clinical care and medical diagnosis, not just lab diagnostics. And it's been regarded as a sleeping giant in healthcare. AI methods show promise for multiple roles in healthcare. AI-powered diagnostic apps are being rapidly developed to improve diagnostic power, and there are a number of advantages to using AI. For example, to reduce errors in patient care and especially in hospitals. Now, errors actually are a major concern in many hospitals. Here in Canada, in North America, in US, in Europe, in Indonesia, in every part of the world, there are many errors that occur that actually can lead to death or significant worse outcome for patients. So these errors have to be prevented and minimized. And it's thought that the use of artificial AI-powered diagnostic tools and tools related to other areas of healthcare can alert patients and physicians about hidden risks of potential adverse outcomes. It can actually help selectively guide attention, care, and interventional programs. For example, in pharmacy, in selection of drugs for treatment, use of AI can significantly reduce errors made by pharmacists. Similarly, in laboratory medicine, it could be very helpful, not just to reduce errors, but to improve effectiveness, to improve workflow in the lab. And basic diagnosis of common ailments have been shown to be can easily be provided using AI-powered tools. And this could potentially relieve pressure on healthcare services. Now, I know in Canada, there are many patients who do not have a family doctor. And I'm sure in Indonesia, this is even a greater problem. Because of your large population, we're only 38 million people here, but then I know Indonesia has many more, much higher, greater population. So the fact that we do not have enough family doctors to take care of the population, this is an opportunity where AI can be used, AI-powered tools, to provide diagnosis without the need for a physician. And there have been studies recently showing how effective these tools can be compared to, and in some cases they can be more accurate than a physical examination by a doctor. In the area of laboratory medicine, this is an example of AI-powered diagnostic tool. It's called a Microsoft HealthBot. It empowers healthcare organizations to build and deploy compliant AI-powered health agents, allowing them to offer their users intelligent, personalized conversational access to health information. For example, the very large lab in the US, this is one of the largest reference private labs called Quest Diagnostics in the US, has started using this tool. And they have used it to create this thing called MyQuest. And this MyQuest tool is AI powered, and it can find test locations for patients. So because there are hundreds, if not thousands, of locations across the U.S. that people can schedule to go and do phlebotomy and provide a blood sample. So and make appointments. So even the appointments and the scheduling is AI powered to improve workflow and improve the speed of scheduling and efficiency of that process. It also can be used, it's being used for other aspects of the lab workflow. So to get answers to non-medical questions, for example, whether, for example, to fast before a blood draw or when to expect lab results. So again, it's an example where one can use AI-powered tools to provide improved lab service. Now, I wanted to finish by talking about some lab reference interval tools. We here in Canada have developed an app which many of you may be familiar with and may have already used. It's called the Caliper app. But there are many other apps in this area of reference range or reference standards or reference values. I've listed several of them here. I'll just talk about the Caliper app. This app was developed in the last few years after recruiting over 12,000 children. We collected blood samples. We tested for over 180 different tests. These are chemistry tests and hematology tests. And then we developed a database. And this is called the caliperdatabase.org. So it's been updated. Actually, the most recent update was in January of this year. So I highly recommend those who are not familiar to try to look at the tool. This is a web app. So it's an app that's available online, and it's free to access. All you need to do is register your email address, your name, and your institution, and you can get access at no charge. And you can get full tables of age and sex-specific reference intervals for children from birth to 18 years of age. And it actually also provides a scatter graphs of data. So you can go in, click search database, then select a test, for example, cholesterol, or select ferritin, or select any of the 180 plus tests. We have now included hematology tests, so you can select a hematology test or a chemistry test or an immunoassay, endocrine, fertility markers, other assays, and be able to get full reference information for that test. So again, this tool can be very useful and is already being used by thousands of it's actually being used by thousands of lab professionals, and the data is based on thousands of healthy and ethnically diverse children and adolescents. because these tests were done, this database was developed in Toronto, Canada. This community is very multicultural, multi-ethnic. We have over people from over 100 different countries in this city. So therefore, the data is not only from Caucasians, but also from Asians, from South Asians, East Asians, Southeast Asians. It includes also Latin American children. It includes African children. So the good thing is that it is somewhat representative of a multi-ethnic population. So it can be useful potentially in Indonesia, although we have discussed, and I visited Indonesia several years ago, and we have on the invitation of Prodia, and we had discussions about potentially a similar study in Indonesia, which I'm hoping that it will actually be completed. It might already be in progress. Now, so I already mentioned the Caliper data is based on over 12,500 children that were recruited, and then we have tested over 185 biomarkers and hematology markers. And the data is based on multiple systems: Abbott instrument, Beckman, Ortho, Roche, Siemens, and others. Therefore, it is vendor neutral. So we have data from different instruments, so you can actually select which instrument you're using, and therefore get more relevant data. The last point is related to the mobile app. We have also created a mobile app. This is available on Apple Store and Google Play. Again, is free to download and use. The nice thing about this app is that the entire database is available, and actually when you download the app, it downloads the database on your phone. So after that, you don't even need Wi-Fi. You can search the database using this app without the need for any connection or mobile connection. You can. This app allows you to select the medical lab test, to select the test, to enter the results. So you can, for example, you select iron, then you enter the lab results. You select what unit you are using in your lab, and then you select, of course, the sex and the age group. For example, if it's a child, it's a 5-year-old child, well, it fits in this category. So there is a pull-down menu you can use. You can also select the instrument. In this case, is Abbott Architect. So you select, and then you click Evaluate, and it gives you an evaluation. If it's a normal value, for example, in this case, it is normal, it shows as being within the reference range, and it gives you an interpretative comment. However, let's say if the result you entered was higher, was 27, well, it gives you a flag, and it says that the result is abnormal. So it's a very simple tool, but it can be very powerful, particularly, let's say, in remote areas in Indonesia, in remote areas, in clinics, in different villages, in small hospitals, clinics, doctors' offices. The doctors can use this app directly for children when they are examining children, and when they have lab results on children, they can compare the result to the Caliper database. And so this is a simple tool. It's not AI powered at this time. It's a fairly simple app, but we're hoping to actually introduce additional basically improvements to this app. So to end, the future is clearly here in terms of medical diagnostic data management and e-communication tools. There is an explosion of new web-based and mobile apps that allow communication of laboratory diagnostic data to healthcare professionals and patients. And these are increasingly AI powered. These tools allow for ready integration of lab data with other medical diagnostic data records to increase clinical effectiveness and improve diagnostic speed and accuracy. There are unlimited applications in delivery of laboratory medicine and clinical laboratory diagnostics. So I want to stop there and thank you all for listening. And I would like to congratulate you on putting together this exciting conference, and good luck with the rest of the program. Thank you.
Thank you, Professor Adeli. That was a real eye-opening lecture by you. Professor Adeli has just taught us not to undermine our data, which is mostly valuable. And indeed, as he said, the laboratory is a giant, a sleeping giant, and a black box with the most numerous information, which is objective data, and may maximally be mined for abundance benefits of healthcare now, especially in the era of AI. The audience, although we did not allocate time for questions for the plenary lectures, but as Prof. Adeli has still several minutes left, he was also willing to answer some questions asked to him by the recording scientist of IFCC, Miswar. We have 4 short questions to Professor Adeli, and I will forward the questions and then we can listen to Professor Adeli's recorded answers. Miswar's first question was, let me see, his first questions was, as the largest and the only real international society in laboratory medicine, it is expected that the IFCC has taken initiatives early on to welcome the challenges of digital medicine, which is now already here at our front door. What specifically has IFCC been undertaking regarding this? Now you can see what his answer is.
The IFCC actually formed a division called the Emerging Technologies Division. This is a division that was developed about 4 or 5 years ago, and it's very active. It actually has a committee on digital tools in laboratory medicine. So there are a number of working groups, and there is a committee that's actually looking at some of these latest tools and going to be coming up with guidelines and publications in this area. So IFCC is very interested and has
Hello? May I continue with the second question? Okay, now the second question was this. In addition to the various platforms and apps you mentioned in your lecture, what do you see as the benefits of digitizing to the patients and the laboratory professionals?
These tools allow the patients to have more vested interest in their own care, to be able to review their own lab results, to be able to go back to the clinician and ask questions. So the digital communication of lab tests to patients can be very helpful because they are more aware of what care they're getting and why, for example, they're being treated by a specific drug or based on the review of their own lab results. But this is also really important to lab professionals because the lab professionals can readily communicate the data to physicians who are the customers of the lab who order the test. So this allows for a better communication between the lab and clinical programs. Now, as you may know, labs are regarded by many clinicians, physicians, and by many nurses as a black box. They don't really know what goes on in the lab. They just send a request and they get back a number, but they don't really understand the lab very well. But effective communication and these types of tools can, of course, improve visibility of the lab for clinicians and therefore better communication. Really, this.
Thank you for the second question. Now, the third question is this. Professor Adeli, besides the apps you presented, I'm sure a lot of different apps are also available. And can you give us some hints as to how laboratory practitioners can get the optimal value of the apps?
Well, I think some of these apps are available for free to access online, but some of them, I think, require a subscription. So if a hospital wants to use, a lab wants to use one of these apps, they would have to look at whether there is a subscription. Some of the better tools do have a subscription, but and they're not that expensive to basically have an annual subscription and use them. Some of them are actually free to use. So it's based on what the lab is interested in. Some of the simpler apps or some of the more complex AI-powered apps. There are, of course, different levels of quality. But one thing I want to mention that it is really important that that lab professionals are careful and not just use any app that is available online. You of the app, the accuracy of the app. You actually may, if you want to use, if you really like an app, you need to test it. You need to use the app for a pilot project and do extensive testing to make sure that it actually provides accurate information. So you should not assume that all of these apps work well. Some of them may have problems and may not be that accurate. So therefore, it's important to select the right app or to select the right database, but also to test it extensively before utilization.
Thank you again. Now, the last question is this. While data digitization provides abundance of advantages to the healthcare system, it also poses risks in security. What is your view in this regard?
Certainly, safeguarding security of patient data is really important. And here in Canada, this is a very major issue. But all hospitals here are not able to provide access for patients. So patient can log in to the hospital database and be able to view their patient results. They also, that includes lab results, X-rays, imaging results, MRI results. So it's not just lab results. It has actually, it provides the patient for information from multiple sources. But this is a secure access. So it's important that the hospital or the private lab that's providing access have appropriate security built into their system, so that when they provide access, it's secure. It of course requires login, it requires a password. It also sometimes requires two-phase or two-stage security, which is becoming more common. So yes, safeguarding security is really important, and as more of these databases and more of these apps are used, one needs to ensure appropriate security. So again, one should not select an app, should not select a database that is not secure. But I think the advances in IT, information technology, it readily allows a good security of patient data. So if appropriate lab tools, e-communication tools are used, this is not a major concern. As a patient, when I get any testing done, I can go in within 24 hours. I get an email that the test results are ready. I can go and check my own lab results, and it's very secure. And it's been available for the last few years, so it's not that new. So it's easy to access. It's secure. Nobody else, only me and my family physician have access to that data. So this kind of security is possible, and I think it's essential. And you had good questions, so thank you.
Thank you, Professor Adeli. Those were wonderful answers to very good questions from Ms. War. We thank Professor Adeli very much for sharing his views with us, for his time and his continued support to IFCC. Let us give a big applause as appreciation to Professor Adeli. Now, before ending this session, let us learn a little more about IFCC, the International Federation, of which Professor Adeli is the current president, and of which IFCC is a member for a long time. IFCC has kindly granted auspices to this working conference. And let us now view a short video about IFCC and its scope and programs, which will be showed by the host. You can click forward. Just click forward. So the IFCC is a worldwide non-political organization with clinical chemistry and laboratory medicine of its scope. And it has 95 full members now, 18 affiliate members, 6 regional organizations, and 49 corporate members. It has 6 regional representatives, and among it is the APFCB, which we are a member of. Next slide. These are all the corporate members. Next slide. We can skip this one. Next slide. Now, the key conferences of IFCC in the coming time will be, the next one is 2022 in Seoul, which we also will have as our regional APFCB conference, and IFCC has other conferences as well. Next slide. These are the key IFCC programs. You can go through it from their website, and the main are establishing global standard settings, supporting members through scientific and educational endeavors, and providing multiple congresses, conferences, and focused meetings in support for laboratory medicine specialists. Next slide. It has 20 plus years of success with the visiting lecture programs, and we have been enjoying also the programs of visiting lecture from the IFCC in the past until now. Next slide. And at the IFCC Speakers Bureau, there are 75 plus experts. There are 45 topics and 579 presentations available, which we can enjoy and ask the presenters to be present at our events. Next slide. The webinar series are also in abundance. 35 plus experts, 15,000 participants worldwide, monthly or bi-monthly presentations, and several topics of interest to the IFCC community. Next slide. Now, please connect to the IFCC through this: Instagram, LinkedIn, Facebook, Twitter, and the other one. I don't know what this is.
Telegram.
Oh, Telegram. Okay. Thank you. So IFCC is the Advancing Excellence in Laboratory Medicine for Better Healthcare Worldwide. Next slide. Visit the IFCC website, tap the icons located at the right top of the page, and follow from the selection menu. I guess this is the last slide. Next one. Yes. So thank you. This was the presentation of the IFCC. Now, this is the end of the first plenary lecture. I am sure that all the audiences has enjoyed Professor Khosrow Adeli's presentation, and we are looking forward to have you at our next sessions after the break. Thank you very much.